In this study that's going to be presented at ACR this year, we saw that patients who report race as Black versus patients who report race as white have differences in their autoantibodies that are associated with their disease, as well as their outcomes. It has already been observed that African American patients with systemic sclerosis have more severe disease and earlier onset of disease as well. And in this study, we sought to understand whether the reason for those differences had to do with specific biomarkers called autoantibodies that we look at clinically, or if something else was explaining those differences. There are specific blood tests that we see with different frequencies in patients who self-report as Black versus patients who self-report as white. So in patients who are Black, we see a higher prevalence of the SEL70 antibody, the U1-RNP, and the U3-RNP antibody. And in white patients, we see a higher prevalence of the centromere antibody and the RNA polymerase III antibody. And these are trends that have been described before, so that finding was confirmatory of previous results. But the next step that the authors took was to see how those blood tests interacted with race in terms of predicting disease severity. And when they did that comparison that put it all together, they saw that the antibodies only predicted a small amount of disease severity, which means that either race or another unreported variable that may associate with race could be important in predicting disease severity.